Okay, so we all know what doctors and nurses do, right? They're on the front lines treating us when we're sick. But what about the experts who work behind the scenes to stop us from getting sick in the first place? In this explainer, we are going to pull back the curtain on the Master of Public Health, or MPH, and find out why this degree is way more important than you might think.
But let's start with a wild question. How on earth did we, as a species, completely wipe out a disease that killed up to 500 million people? And that's just in the 20th century. It wasn't just some lucky medical breakthrough. The answer is actually hidden inside a very specific set of skills, the exact skills that people with an MPH are trained to use.
So, here's our game plan. We're going to open up that population health toolkit. Then we'll see how MPHs have literally changed history. We'll look at a pretty scary workforce gap we're facing right now and a new threat that could make it even worse. And finally, we'll see how the public health community is fighting back. All right, first up, the Population Health Toolkit. So what exactly is an MPH? It's not just another master's degree you hang on the wall. It's a professional training program that basically teaches people how to protect the health of an entire city or even a country, not just one patient at a time. Think of it this way. A doctor treats you when you have the flu. An MPH professional is the one trying to figure out why 1,000 people in your town all got the flu this month, and then they design a system to stop it from happening again next year. They're like doctors for society itself. And to do that, you need a pretty unique skill set. You learn how to look at data and see patterns that no one else does. You learn how to spot risks, not just in a virus, but in our laws, in our environment. You learn how to design these huge, complex interventions, like citywide vaccination campaigns. And maybe most importantly, you learn how to talk to people about risk in a way that builds trust. That last one is huge. Okay, so that's the theory. But let's look at what this toolkit can do in the real world. I'm talking about some of the biggest public health victories in human history. Remember that disease I mentioned? Smallpox. And that number, it's just staggering to think about. For most of human history, smallpox was this unstoppable force of nature. The whole game changed with a global program led by this guy, D.A. Henderson. Now, look closely at his credentials. He was an MD, sure, but he also had an MPH. And that Master of Public Health, that was the secret weapon. Because here's the brilliant part. A lot of people think they just went out and vaccinated every single person on Earth. Not even close. The reality was so much smarter. Henderson's team used a strategy called surveillance and containment. They track the data to find outbreaks, and then they'd swoop in and vaccinate a ring of people around those cases. It was a masterpiece of data, logistics, and getting entire governments to work together, all core MPH skills. But this toolkit isn't just for fighting ancient viruses. Let's fast forward to the 1980s. California was facing a totally different kind of epidemic. This time, it was caused by tobacco. Smoking rates were through the roof, and so were deaths from cancer and heart disease. And would you look at this chart? This shows what happened after they launched the California Tobacco Control Program. Cigarette use absolutely plummeted. We're talking a drop of over 60%. That does not happen by accident. That is a designed outcome. So how'd they pull it off? With the full MPH playbook. They used massive media campaigns to make smoking less socially acceptable. They pushed for new policies like clean indoor air laws. They organized communities. And all the while, they were constantly tracking data to see what was working. It was this perfect blend of communication, policy, and data that became the gold standard for the entire world. Now, these stories are incredible, right? They show what's possible. But they also make you wonder, are we still ready for today's crises? The COVID-19 pandemic was like a global pop quiz for our health systems, and frankly, it revealed a huge, dangerous gap in our defenses. And the data that came out of that natural experiment is crystal clear. The places that had strong public health departments, the ones staffed by people with MPH-level training, they did better. They responded faster, they communicated better, and they had lower death rates. Having trained experts in charge literally saved lives. Which makes this next number just unbelievable. Right now, in the U.S. government's public health workforce, only 14% of people have any kind of public health degree. And wait, it gets even worse. Only 8% have a specific MPH degree. Let that sink in. The vast majority of people tasked with protecting us, with managing disease surveillance and coordinating emergency responses, have never been formally trained in the core skills needed to do that job. So what does that mean? It means we are relying on people to learn on the job while the house is on fire. And this quote just nails it. It's not just a bad strategy, it's a structural vulnerability for our entire country's health security. You would think that after everything we've been through, we'd be racing to fix this, right? To train more people? Well, believe it or not, a new proposed rule change is threatening to make this gap even bigger. Okay, here's the deal. And it's a little bit in the weeds, but it's so important. The Department of Education is proposing a new definition for what counts as a professional degree. Right now, the MPH is on that list. The new proposal would kick it off. It sounds like a tiny change in paperwork, but the consequences could be huge. So why should you care? Because if the MPH loses its professional status, it could get harder for students to get the federal loans they need to pay for school. It just creates this massive financial hurdle, making it tougher for people to get this vital training. It would essentially choke off the pipeline of experts we desperately need to be building up. Now, the public health world is not taking this sitting down. Key organizations like the Association of Schools and Programs of Public Health, or ASPPH, are mobilizing a massive coordinated response to fight this. And they have a clear 5-point battle plan. They're doing everything from directly lobbying Congress and gathering hard data on the damage this rule would do, to flooding the system with formal comments and even looking at potential legal challenges. This is an all-hands-on-deck moment for them. And their core argument is actually really simple and really powerful. Training public health professionals is not some academic luxury. It's a critical piece of our national infrastructure. It's just as essential as training engineers to build safe roads or training doctors to save lives in the ER. Which really leaves us with one final sobering question. We've seen what these experts can do, from ending smallpox to fighting pandemics. We know we need them. So as we look to the future, we really have to ask ourselves, when the next crisis inevitably comes, who will be trained and ready to protect us?